Thank you so much. If I have a patient with a somatic nervous system problem, this patient also had an abnormal stepping pattern. Please place your left foot forward. But this changed when we raised the foot arch. In a patient like this, I will need to work on her muscles, on the somatic nervous system. And just a little bit forward, please. This is very good. I will work with her at the muscle level, and this is how we diagnose the stepping pattern. I will show you various types of the step pattern, how you diagnose and how you challenge them and fix them, and our colleagues will show other variants. This here you see the alarm points of the internal organs. You will see a diagram, and you will have all of them in the kinesiologist's case with you. If a patient has a problem with the autonomic nervous system, massage and manual therapy are not effective, and they're even dangerous. They will provoke emotional problems and aggravate their health. If I have a patient with an affected somatic nervous system and I see that the foot is the affected region, I need to see if it's the peripheral, segmental, or central level. We always start with the central level. The central level is represented by the myofascial circuits. If the person stands upright, the muscles form a muscle chain, a muscle line from the feet to the head. And when a muscle is not working, some muscles become weak, but not when they're lying down. I want to see how the anterior myofascial circuit is working, and I want her to bend the muscle, to bend the knee joint, and I see how normal, how strong she is, and she should be weak normally. And please lift your head. I want her to check the myofascial chain. No change here. There's no problem with the anterior myofascial chain, but she has her foot arch down, and this is the posterior tibial muscle, and I'm checking her condition. Please put your toes down, and please move closer towards me. Okay, there you go. And please do a close-up of the foot, and please bend the other leg, and please have your toes inwards and hold the muscle like this. Try and preserve this position and push, and I will resist. The muscle is in a perfect tone. How so? I saw it with my own eyes that the arch of her foot was down, and we even put a footrest under it, and she would hold on, and I'm looking at her as she lies down, and she's in a perfect shape. Why did this happen? Because when a person lies down, the myofascial circuit relaxes, and I will activate the myofascial chain now. In order to do that, I will have her lift the chin and press like this, and I will see if there's any response. No, not possible to lift up, and inwards and inwards, and do not lift it. Okay, fine. Now the muscle goes weak. But this is a small muscle, but what will happen to the long muscles? Please press your legs against each other. This is the abductor muscle, and one of the strongest muscles. Please press your chin and move your leg. And your legs. Press your legs only on one side. And now we see the structure in the iliopsoas. Just look how beautiful it is. In a patient like this, her muscles become weak along the large joints, especially the pelvis and the shoulder. How do you feel the pain now? And now I have raised her head. I know that the muscles in the chain will be weak and then the joint will not be protected. How is it? Oh, ouch, ouch, head down. Is it ouch? Raise your head. Ouch, ouch, ouch. That's how the latent compression syndromes work. When she's standing, the neck muscles get activated. This immediately deactivates the long muscle chain and all these joints suffer. Let's enjoy her suffering. How is the pain here? Now please, only these muscles. Raise your head. How is the pain here? It's painful. It's more painful. What about here? There's some pain here as well. And now have your head down, and there's less pain. But I will show that on the pelvis. This patient comes and on the hip joint. Such a patient will come and say, I cannot stand, I cannot sit, but when I lie down, all the pain goes in the joints goes away. This is because when they lie down, the myofascial chain is not activated and there is no stabilization like this. In order to restore the cervical spine, you need to fix the left foot. In order to fix the left foot, you need to find the cause in the myofascial circuit. I'm looking at the muscle. Maybe the reason is the muscle itself. Maybe the posterior tibial muscle itself that's affected. Please press your legs together. Maybe this is the abductor muscle that is affected. I activate the chain and press your legs together. Press your legs together. Maybe that's the iliopsoas that's affected. Ouch! Now press your chin and you press your legs together. And press your legs together. Let's try and look at the muscle. Raise your head and the initial position. What if I try and press? Will the reaction be the same? Ouch. Legs together. Very good. What this patient has is the pain in her right shoulder. This is due to the instability of the ankle joint on the left. I activate the deep myofascial chain through activating the trigger points in the iliopsoas. I place my hand on the bone here and I find the trigger point and I have the attachment points pressed together and until the pain goes away. How is your pain? Oh, the less pain like this. How is the pain? Now there's less pain, or is it best to press in this direction? Yes, this is better. And now I work the trigger points, and this is completely painless for the patient. I activate the deep myofascial chain, and we have all the circuits, all the chains analyzed at the clinical level. Please go to the classes, come to the classes and learn about that as much as possible. As soon as the pain goes, as soon as the pain abates, I go deeper. You seem to be less talkative. You seem to be very quiet. So it's not an ouch, ouch. No, it's your muscle. It's mine. You have to work with it the way I work it. In order to remove the problems, to fix the problems in all the trigger points, I will do that. I want to see if I've done a good job. I lift the leg, I look at the muscle. I have her lift the head, I look at the muscle. And now I have her stand on her feet. Here you go. All right. You seem to be looking better. You seem to be more cheerful. And your shoulder is down. This is amazing. But what I want to see is the stepping pattern. Place this foot forward and more forward. This is normal here, and this should be weak. And this is how we do the correction. That's how we fix this. I would have never thought that she has a problem on the side of the iliopsoas. This is not the end of the treatment. We need to figure out why the spasm occurred. Maybe that's because of the hypotone of the other muscle and of the kidneys or the adrenals. But we'll stop here for now.